Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. Doctors and nurses, I'm going to start with the new role play that is of snake bite. This could be common for both the professionals, that is doctors and nurses. But particularly, I'm taking the nurse role play today. Setting is emergency department, and the nurse role is to see a 40 years old panic patient with a snake bite. He or she has no symptoms of any complications, and you're collecting his or her details and explaining the situation. Now, what is your task? Find out the reason for his or her visit, find out details of snake bite, that is onset, severity of pain, etc. Ask details of snake, for example, the type, appearance, color of the snakes. I'm going to start. I'll simultaneously explain the things to you so that you should be able to understand how it is to be done. As it is the topic of emergency department. So in that case, you may start with, hello, my name is so-and-so, whatsoever the name of yours. So you may say that, let it be, my name is Jenny. How may I help you? Because it is emergency department. Obviously, you have to ask the patient about his or her concern. The person who comes to the emergency must be in anxiety or panic. So first of all, you have to console the patient, convince the patient, make the patient stable, comfortable. Then you may ask the raised questions. Then the patient may ask that, nurse, a snake has bitten me and I just want to get the treatment immediately. Then show empathy first of all. Then you should say that, okay, I'm so sorry to hear this. Be relaxed. You are in the safe hands and the best treatment will be provided to you. These are some of the phrases you can use to convince the patient or to make the patient comfortable. This you can use in other role plays also. Then, second could be, how may I address you? Because only then you will be able to continue the task. Otherwise, there is another option. If you feel that your interlocutor is somewhat cooperative, then you may ask this question in the 3 minutes preparation time. When you have 3 minutes, then you may ask, how may I address you, or how would you like to be addressed? In that case, you may take the same name, but here we have the option. We can ask the patient, how would you like to be addressed, or how may I call you? As we don't have any particular gender given here, you may consider it to be male or female, and you may ask the interlocutor how he or she would like to be addressed or taken. 90% of the interlocutor would go with their own gender. Suppose it is a male who is your interlocutor, he'll say that my name is Wilson, and suppose it is a female, then he may say that my name is Lisa or something like that. Okay. Now you have to collect the details of the patient. First, we have already covered that. Find out the reason for his or her visit. Then find out details of snake bite. For example, onset, severity of the pain. Then your next question could be, after making the patient comfortable, then you may ask the patient that, can you please elaborate a bit more to me? When did it happen? Means when the snake bit the patient. The patient may say that it just happened few minutes back, because usually the patient who is panic after the snake bite would definitely rush to the hospital immediately. And in that case, it would have happened maximum 10 to 15 minutes ago. Only the traveling time which has taken, the patient may tell that it just happened 10 to 15 minutes back. Then to make the patient more comfortable and cooperative, then you can appreciate the patient by saying that, first of all, I would like to appreciate that you came on time, or you took the decision to come to the hospital immediately. It is really commendable job. Then the patient has told you that it happened 15 to 20 minutes or 10 to 15 minutes back. Then the next questions could be, may I examine you? Then you should see the snake bite area where the snake has bitten. Usually the snakes which are poisonous, when they bit or sting any patient, at that time the area of bite usually turns blue or black, and there is severe pain at that area. Now, in this case, they have shown that there is no complication. This means the snake was non-poisonous. Then your next questions could be, after examining the patient, because you have seen that the patient does not have any bluish area on the snake bite or there is no intense pain. Then you may say, ask that, do you have any other symptoms? Can you please tell me about how you're feeling now? Apart from being panic, the patient is not showing any complication, like no blood vision is there, no shortness of the breath. It was only when the patient arrived to you, at that time the patient was a bit dyspneic due to panic. But now, as the patient has been in a comfortable position, the patient has become stable, and his breath has also maintained at the normal rate. Then you should ask the patient, are you able to see properly? Do you have any other symptoms? Can you please tell me what you're feeling at this time? These could be the questions you will ask the patient. Now, this is the information gathering. Your examination and information gathering is done. Then the third part is, as I already told you in the previous role play, that we have three parts of role play. First is introductory part. In that case, you have to introduce yourself and ask the initial questions to the patient, that how may it raise you, what brought the patient to the hospital or to the emergency department. Then you should start with the next part, that is second part, information gathering part. We have done this now, and now become the third part, that is how to reassure the patient or tell, or we start the remedial part. As this patient seems to be in a stable condition, there's no complication, this shows that the snake was non-poisonous. Then you can say that, Lisa, rest sure or be comfortable. I feel that the snake was non-poisonous because you don't have any symptoms of that. Before this, you may say to the patient that, let me check your vitals first. And this is also an examination part. Then you may say that as your vitals are normal, this indicates that a snake was non-poisonous. So be relaxed. Don't get panic now. You are safe. It seems that there is no complication and you will not be harmed by this. Then non-poisonous snake wound treatment and self-monitoring. You have already examined the wound, and apart from the sting site, bit redness, it could be, or only the signs of the teeth of the snake is there. There is nothing else. You can clean the wound. You can say that, let me clean the wound. Then you should tell the patient, Lisa, as it seems to be non-poisonous case, you just have to be relaxed. And as I'm going to clean the wound, there is no need of dressing on the wound route. Secondly, be comfortable and be confident. Provide you some of the medication, or otherwise medication is not required in this case. And self-monitoring could be, the patient can monitor her or himself by own, because they just have to be confident and make themselves sure that this was a non-poisonous case, and there is no chance of to be panic or anxious. 90% of the patients, they die only due to shock or panic attack. In this case, the management of this task role play is only to make the patient relaxed and the patient should not get panic. The last part is explain when to see doctor. Example, swelling symptoms worsen, severe pain. You may end up by saying, Lisa, I don't find any symptoms of poisonous snake. So in this case, it seems that this was non-poisonous and you are safe. Otherwise, I'm giving you a pamphlet which has the complete information regarding do's and don'ts. As at this time, be relaxed and you can lie on the bed comfortably. You may take your food, but it should be the light food, should not take the heavy food. Secondly, if you find any symptoms like there is swelling, redness, or bluishness on the bite area, or you find that there's severe pain, in that case, you can contact us at the emergency number. Otherwise, I feel that you will remain comfortable. There is no sign of any type of the complication by seeing your vitals and examination. So hope to see you in a good condition, and just take this pamphlet. If you find any problem, then you can contact us at the emergency number and the best treatment will be provided to you. In this way, you can end up the topic. Now, as this topic was of snake bite, and similar topics can be dog bite, there can be bull ant stings, honeybee stings, and wasp sting. So I'm going to cover those topics afterwards in the same series. Stay connected. Hope you like this video. And if you like this video, do not forget to like, share our video. And if you haven't subscribed our channel yet, do subscribe it right now, so that you should be able to get the latest information on the updates on our channel. As I have started this series of the role plays on my channel, you will be getting the valuable insights on these, which will be quite helpful to you in your coming future. Above all, I'm telling you that I'm feeling blessed to be an author of a book that is Crack OET at First Attempt, an ultimate guide to OET for doctors and the nurses. This is going to help you a lot because I have covered 20 role play samples in this book. Along with this, I have given many phrases, vocabulary words, which is going to help you a lot. And above all, there will be tips and tricks to get 450 plus. This means A grade in OET. Stay connected, stay healthy, and just subscribe our channel. If you want to get information on any of the role play, just comment me so that I should prepare that role play. Stay healthy and stay happy. Happy learning. See you with the next video very soon. Thank you so much.